Good evening mga ka-SFT. Kumpirmado na pong nakapasok ang novel coronavirus sa bansa. Sa gitna ng balitang yan, umiingay ang panawagan na pansamantala munang iban ang mga Chinese tourists sa bansa. Pati ang pagpasok ng mga ukay-ukay, hihigpitan daw muna para makaiwas sa sakit. Live streaming first before airing on GMA News TV, I'm Atom Araulio. Stand with us, stand for truth. Kinumpirma na po ng DOH ang pagpasok ng novel coronavirus sa bansa. Ang pasyente ay isang Chinese national na nakakonfine ngayon sa San Lazaro Hospital. Shai Lagarde reports.
From around 40 cases in Wuhan, China by January 4 and its first reported death on January 11, the novel coronavirus has now infected nearly 8,000 people in all provinces of China and killed 170 patients. Halos 100 na rin ang kumpirmadong kaso nito sa labas ng China. And as of today, January 30, kabilang narito ang Pilipinas. The Department of Health has officially announced the first case of the Wuhan coronavirus in the country.
The DOH is confirming that a 38-year-old female Chinese patient under investigation, or PUI, is positive for the novel coronavirus.
Iba pa ito sa inireport kahapon ng DOH na 29-year-old Chinese PUI o patient under investigation for ncov na namatay sa San Lazaro Hospital. Pneumonia ang ikinamatay nito at hindi pa dumarating ang resulta ng ncov test mula Australia.
The confirmed case arrived in the Philippines from Wuhan, China, via Hong Kong last January 21, 2020. She is currently asymptomatic, which means she has no fever, and no other signs and symptoms. DOH has recorded a total of 29 PUIs. 23 PUIs are currently admitted and 5 have been discharged but are still under strict monitoring.
The places where they've been to in Cebu and in Dumaguete. Then we do the contact tracing. For the plane, the community, we are looking at the establishment where they stayed, the establishment owner, to identify the employees that had been in contact with the patient, and from there do the mandatory quarantine.
If you're looking at a mortality rate, you're talking of less than 3% deaths. This is much lower than previous coronavirus infections.
Walang vaccine o gamot para sa virus, kaya't ang pag-iigtingin raw ng pamahalaan ay ang security and preventive measures. For other countries, this includes imposing a temporary travel ban to and from China, which the Philippines has yet to finalize.
We can marshal what we have, but what we do not know, we are at a loss really of what to do. Just like other nations now. We are preparing in all ports of entry to limit the people entering maybe the Philippines. It could include China, but at this time, I am not for it. It would not be fair.
Given these developments, the DOH and WHO strongly advise everyone to follow their constant reminders regarding hygiene and preventive measures.
Washing of the hands. If you have alcohol, you apply alcohol on your hands, on your palms. And then the cough etiquette, the maintaining the distance of not less than 1 meter apart from the next guy in front, at the back, or at your side. You have to drink a lot of water. Make sure your throat is moist so that the virus doesn't attach to it and gets eventually absorbed. And then, of course, the intake of nutritious food stuff rich in vitamins A, C, D, E, and also mineral, zinc. Drink a lot of fruit juices rich in vitamin C. Eat put malunggay in many of your soup or other food stuff, and avoid crowded places as much as possible. And if you are feeling any of the symptoms I have just mentioned, do wear a surgical mask. It's going to help prevent the spread of whatever virus you have. Because if your resistance is weak, then even the ubiquitous organisms that we breathe every now and then will tend to cause disease in people with very poor immunity.
Paalala rin ng DOH at WHO, huwag magpanik at manatiling nakatutok sa updates. Maintain presence of mind to address this epidemic more effectively. I'm Shai Lagarde and I stand for truth.
Kung nakita mo na ang viral video na ito sa social media, malamang nabasa mo na rin na kinunan daw ito sa Wuhan, China, kung saan nagsimula ang novel coronavirus outbreak. Makikita sa video ang isang babaeng kumakain ng tinatawag na bat soup na inalmahan ng mga netizens. Pero ang video na ito, 2017 pa raw in-upload at hindi sa Wuhan kundi sa Palau. Ganito rin ang nangyari kay Marzin Caber, isang Pinoy na dating waiter sa Palau. Nag-viral ang kanyang vlog kung saan makikita na kumakain siya ng bat soup. Nire-upload kasi ito ng mga tao sa kasagsagan ng outbreak ng coronavirus.
Let's taste the soup first, okay? Amoy mapangi siya, pero pag tinis mo siya, parang sinigang na kulang sa ingredient.
I-clear ko lang na sa Palau nangyari yung video and nung date na yon it's July 2019. Hindi siya ginawa sa China. Never ako nagkasakit simula nung umuwi ako ng Pilipinas. Hanggang ngayon, never ako nagkaroon ng lagnat and any fever or anong sakit, wala. Malakas na malakas ako.
Tinanggalan ni Marzin ang comment section sa kanyang vlog dahil daw sa masasakit na mensaheng natatanggap niya.
Yun nga, mamatay na kami. Kami daw yung nagdadala ng virus sa Pilipinas, na wag na namin dalhin yung virus dito at marami nga mapapahamak. Yun nga, hindi nila kasi na-check yung info kung kailan ginawa yung video at kung saan. Kasi nga, yung nag-upload sa Facebook, iba na yung naka-caption.
Pero kahit hindi galing sa China ang mga video, meron na daw talagang nangyayaring bentahan ng exotic wildlife sa ilang mga market sa China na pinaghihinala ang sanhi ng ncov. Sa katunayan, ipinagbawal na ng mga otoridad ang pagbebenta nito sa buong China. Pero ayon sa isang eksperto, hindi na dapat hinintay ang outbreak para ma-enforce ang mga regulasyon patungkol sa wildlife trade.
There were guidelines, but guidelines were not being followed, or even if they were being followed, they didn't realize the risk it would have led. But now the incident in Wuhan will probably make the Chinese look more, be more careful.
Pero bakit nga ba naging parte ng food culture sa China ang exotic meat?
They would eat wildlife because these are expensive. Especially the more endangered they are, the more they can brag about it that, oh, I've eaten this kind of meat. In some cases naman, they believe that eating certain animals is beneficial. For example, in some parts, some Chinese would eat snakes in winter because they believe it helps them keep them warm. But then Filipinos also, we eat snake. Like, who hasn't heard of adobong sawa? It's not Chinese in general who would eat all these exotic wildlife.
Sabi ng mga medical practitioner, may concern pa rin sa pagkain ng mga exotic food gaya na lang ng bat soup.
But this one, the WHO has said it came from exposure to the exotic wild animals. So pwede nating sabihin it's from pagkain po. Pwede rin, when they were there, they inhaled something from these exotic wild animals. Or may hinawakan ba sila? So more than one mode of transmission, we cannot say. But of course, they were able to identify that it came from the marketplace in Wuhan. So possible po ito because we have had other diseases that have come from animals, not necessarily exotic.
Habang parte na rin ng kultura ng iba ang pagkain ng exotic wildlife, mabuti na rin makinig sa kung anong sinasabi ng mga eksperto para na rin sa kalusugan ng publiko. I'm Edward Faraon and I stand for truth.
Ikinagalit ng China ang drawing na ipinublish sa isang Danish newspaper. Ang stars kasi sa flag ng China, pinalitan ng drawing ng virus. Izzy Lee has the story.
Matingkad na pula at may 5 bituin ang flag ng China. Pero sa editorial cartoon ng Danish newspaper na Jyllands-Posten, ang mga bituin pinalitan ng virus icons. Sabi ng Chinese Embassy sa Denmark, insulto ito sa China. Lumampas daw ito sa pamantayan ng isang civilized society at sa boundaries ng free speech. China demands a public apology. Depensa naman ng editor-in-chief ng Jyllands-Posten, hindi nila intensyong insultuhin ang China and they can't apologize for something they don't think is wrong. Nasa 7,000 na ang confirmed cases ng ncov at nasa 170 na rin ang namatay dahil dito. Karamihan sa kanila ay mula sa city ng Wuhan sa China kung saan nagsimula ang outbreak noong December. Kasabay nito, racism against Chinese and Chinese communities around the world has begun to spread. Kagaya na lang ng na-experience ng Filipino-Chinese na si Wesley.
Sa isang convenience store, clerk was commenting about dumarami na raw ang mga Chekwa na namimili tapos wala raw available na masks. So parang in danger daw sila. So, hindi siya tumigil until I started talking to the person in pure Tagalog.
Masakit daw kay Wesley na marinig ang mga komentong ito mula sa kanyang kababayan at para sa kanya, ang pag-publish ng controversial editorial cartoon ay hindi nakakatulong.
I think it definitely adds to the tension na related dun sa coronavirus. But why do you have to fuel the hate that's being spewed around?
I find the editorial cartoon a bit racist in the sense that it tends to generalize the issue of the coronavirus. Sa aking palagay, hindi naging responsable yung ginawa ng Jyllands Posten na Danish newspaper kasi hindi talaga malinaw kung ano yung mensahe ng editorial cartoon. At pagka hindi malinaw, meron talagang tendensya na maging racist ito.
You will be no better than the people who are stereotyping and discriminating.
Ang issue ng coronavirus is more than just a public health issue now because it tells us to look in all our diversity and challenge stereotypes. Ang takot na mahawaan, huwag sanang humantong sa pagkamuhi sa ibang lahi. Ako si Izzy and I stand for truth.
Pati pagpasok ng ukay-ukay, hihigpitan na raw ng Bureau of Customs dahil sa banta ng ncov. May ulat si MJ Jeronimo.
Mahilig sa ukay-ukay ang maraming Pinoy. Sa halagang 50 pesos o mas mababa pa, may OOTD ka na. Pero ang mga ukay-ukay galing abroad, pwede nga bang magdala ng sakit gaya ng novel coronavirus?
Sa isang building na ito sa Quezon City, 4 na palapag ang puno ng mga nagtitinda ng second-hand clothing o yung tinatawag natin na ukay-ukay. Mura kasi yung mga ibinibenta nilang damit dito, may nagkakahalaga pa na as low as 10 pesos each, kaya patok talaga sa mga namimili.
Sa gitna ng banta ng ncov, mas maghihigpit na raw ang Bureau of Customs sa pagpasok ng ukay-ukay sa bansa. Si Aubrey, 5 beses sa isang buwan daw kung mamili sa ukay-ukay kasama ng kanyang nanay.
Kami ni Mami mahilig sa ganito kasi yun mura nga.
Hindi raw niya naisip na pwedeng makakuha ng sakit gaya ng ncov sa mga ukay-ukay na kadalasan sa ibang bansa kinukuha.
Hindi ako natatakot na mamili. Hindi ko naisip na pwedeng baka may mahawa sa ganun. Wala.
Hindi na raw nilalabhan ang mga ukay-ukay kadalasan.
Actually, i-display na namin. Bahala na ang customer kung paano nila lalabahan.
Ang alam ko po kasi ay naka-spray na. Yung wala pong amoy, ay hindi na namin kailangan labhan.
Pero hindi pa rin daw maalis sa mga nagtitinda na protektahan ang kanilang sarili dahil sila mismo ang nagbubukas ng mga kahon.
Minsan nagtakot ako kasi syempre hindi mo alam yung mga kung saan galing or amoy, di ba? Pero okay naman po.
Sabi naman ng spokesperson ng San Lazaro Hospital na si Dr. Ferdinand de Guzman, maliit ang chance na makuha ang ncov sa mga ukay-ukay na damit.
Very less likely po na magsasurvive ang coronavirus, ang novel coronavirus sa ganyang mga gamit. Kasi ang coronavirus po, even at room temperature, mamamatay po yan. So how much more sa tagal ng biyahe po and mainit, so posibleng hindi po nakasurvive.
Kahit daw infected ng ncov ang nagsuot, less likely na maipasa ang coronavirus kung ibinyahe na papunta ng Pilipinas.
Most organisms po kasi when exposed to sunlight, mamamatay po yan. Ito naman pong mga sa ukay-ukay, yung mga goods, hindi naman sila buhay na tao.
Kung may iiwasan man daw, yan ay ang karaniwan ng siksikan ng mga tao sa mga ukayan at iba pang lugar.
Avoid crowds po. So kung talagang hindi nyo mapigilan po ang inyong urge to shop, wag po sumabay sa iba at walang dikit-dikit po. No? So muna may distansya muna as long as you wear a mask and disinfect. Wash your hands afterwards.
Human-to-human transmission pa rin daw ang pinakamabilis na paraan para magkaroon ng novel coronavirus. Kaya para sa mga mahilig mamili sa ukay-ukay, pwede pa rin naman daw kayong mag-shopping without the fear of contacting the virus from the clothes. I'm MJ Jeronimo and I stand for truth.
The Philippines now has its first confirmed case of the novel coronavirus. Sabi naman ng DOH, handa sila na harapin itong challenge na ito. But before this announcement, si President Duterte mismo ang nagsabi that he was not inclined to impose a travel ban on people coming from China, specifically Wuhan.
Unang-una, Atom, no? Yes, it's hard to prevent the spread of mga ganitong epidemic, no? But this was not unavoidable, no? This could have been avoided. Let's not forget, hindi lahat ng mga neighboring countries ng China affected. Mongolia has already shuttered their borders. Hong Kong is significantly reducing their inflow of folks from China. But you already see many countries are taking, extraordinary measures. No, I think in the case of Australia, they're looking at mandatory quarantine for people coming from certain areas, no? Especially Wuhan. No? All the while dito sa Pilipinas, higit sa 100 tourists from Wuhan were allowed to come into the country even though the lockdown was being implemented na in China.
Yeah,
no?
that's true.
At the Bureau of Quarantine nung isang araw, sabi nila, okay daw, even yung mga cruise, no? And then, of course, nung isang araw, I think many people were also very disappointed, in fact, shocked that Health Secretary, no, Mr. Duque, was saying that there'll be political and diplomatic implications if ever we put more travel restrictions or travel ban against China, no, including yung mga specific areas like people coming from Wuhan, no. And it was quite surprising for a Health Secretary to suddenly talk about diplomatic and political ramification because the priority of the government should not be the diplomatic relations with China, should be the welfare of the Filipino people. Ang concern ko ngayon, Atom, is there could be a lot of explosion of uncertainty or distrust in the government right now. Baka asipin ng tao, nagka-cover up ng government. And the problem here is that you can have what they call blowback. Kung saan the response from people could be even worse. Kaya ngayon, ang trabaho ng government is to regain the trust of the Filipino people. Any shadow of doubt na may cover-up or the government is downplaying this will even make the situation worse. And it didn't help that the government constantly emphasized the importance of political and diplomatic relations with China when their priority should have been the protection of the welfare and the health of the Filipino people.
Ngayon po na nakapasok na ang novel coronavirus sa bansa, unang-una po huwag tayong magpanik. Meron tayong mga pwedeng gawin para makaiwas sa sakit. Unang-una, huwag po tayo masyadong hahawak kung saan-saan at iwasan po natin hawakan ng ating mukha kasi po yung virus ay napapasa dahil sa mga droplets. Pangalawa, maghugas po tayo ng kamay often, makakatulong din po yan para makaiwas sa sakit. At ang paggamit ng ganito, isa po siyang simpleng surgical mask. Ito po ay readily available sa kahit na anong drugstore. Just make sure that the white part is facing inside dahil ito po ay absorbent sa moisture. Just fasten it over your nose and mouth like that. Very simply. And then, pwede nyo pong ipinch itong alambre sa may bridge ng ating ilong para mas komportable. Thanks for watching. I'm Atom Araulio. We'll see you again tomorrow. Stand with us. Stand for truth.